President.
Senator from Kansas.
Mr. President, thank you very much. I spoke yesterday on the Senate floor about my concerns with the nature of the way that the Department of Veterans Affairs was being operated. Much of my concern occurs as a result of conversations I've had with veterans back home in Kansas and their experiences both on the benefit and medical side. Some real concerns with individual examples of things that have happened in some of our VA facilities in our state. And this growing sense that the Department of Veterans Affairs has become unwilling to provide the necessary services in a cost-effective, efficient, timely manner that our veterans so deserve. As I indicated yesterday, there's no group of people that I hold in higher regard than those who've served our country and believe that the benefits that were promised our veterans must be provided to them. And I'm concerned that that's no longer the case. I indicated yesterday that I've served on the House and Senate Veterans Affairs Committee for now 18 years. I was the chairman of the Healthcare Subcommittee. I've worked with 9 secretaries at the Department of Veterans Affairs. And during that time, I always had the sense, until the last few years, that things were always getting better for our veterans. And today, the frustration that I bring to share with my colleagues is the belief that many veterans no longer have hope that the Department of Veterans Affairs is there to meet their needs and to care for them. In preparing for those remarks yesterday, but really in studying this issue over the last several years, there's a real shocking development, which is the number of times we hear stories, incidents, facts about what's going on with our veterans at the Department of Veterans Affairs and the services that are being provided. And just to highlight to my colleagues, based upon Inspector General reports that are then in part based upon press reports, here are some things that we have seen and heard about the Department of Veterans Affairs and their efforts to care for America's veterans. The one that's in the news at the moment, and there's an additional IG report that's being anticipated, but the Phoenix Veterans Affairs Hospital Administration apparently developed a secret waiting list of up to 1,600 sick veterans who were forced to wait months to see a doctor. It is believed that at least 40 U.S. veterans died waiting for their appointment as a result of being placed on the secret waiting list. Again, this is being investigated. A report is expected, and we will see what that report says. But clearly, this is one of huge concern, resulting in potentially the death of veterans. There's a wait time cover-up. According to the GAO, the Government Accounting Office, last year, this is quoting them, it is unclear how long an appointment has been delayed because no one can really give you accurate information. It is so bad that GAO staff have found evidence that VA hospitals tried to cover up wait times, fudge numbers, and backdate delayed appointments in an effort to make things appear better than they are, unquote. In addition, the GAO stated that, quote, nothing has been implemented that we know of at this point, unquote, despite the fact that the GAO and the VA Inspector General has reported similar findings over a decade. Reports of falsifying records, a story from the VA clinic in Fort Collins, Colorado, where the VA's Office of Medical Inspector found, quote, clerks were instructed how to falsify appointment records, so it appeared that the small staff of doctors were seeing patients within the agency's goal of 14 days, unquote. In fact, the investigation determined that clerical staff at the Colorado clinic were punished if they allowed records to reflect that a veteran waited longer than 14 days. Let me say that again. In fact, the investigators determined that clinical staff at the Colorado clinic were punished if they allowed records to reflect that a veteran waited longer than 14 days. No oversight on quality of care. In December, a GAO reported that the VA hospitals, their finding was that patients were not being protected from doctors who have historically provided substandard treatment. None of the hospitals examined by the GAO in Dallas, Nashville, Seattle, and Augusta, Maine adhered to all of the requirements to review and adequately identify providers who are able to deliver safe, quality patient care. In Los Angeles in 2012, more than 40,000 requests for diagnoses were, quote, administratively closed. and essentially purged from the books so that the reported wait times would be dropped. And in Dallas in 2012, another 13,000 appointments were canceled. According to the Washington Examiner, the VA canceled more than 1.5 million medical orders with no guarantee that the patients actually received the treatment or that the tests that were required by those orders were given. By the VA's own admission in April of 2014 fact sheet, cancer screenings delays accounted for the death of at least 23 patients in VA facilities nationwide, and another 53 patients suffered from some type of harm due to improper care. Reports have also linked poor patient care, maintenance issues, and unsanitary practices to at least 6 preventable deaths in Columbia, South Carolina, 5 in Pittsburgh, 4 in Atlanta, and 3 each in Memphis and Augusta, Georgia. Other reports, more than 1,800 veteran patients in the St. Louis VA Medical Center may have been exposed to HIV and hepatitis as a result of unsanitary dental equipment. The facility has remained under fire for patient deaths, persistent patient safety issues, and critical reports. Despite the problem at the medical center, the facility's director from 2009 to 2013 received nearly $25,000 in bonuses during her tenure there. CNN reported that after they obtained VA internal documents that deals with patients, after the VA obtained internal documents that deal with patients diagnosed with cancer in 2010 and 2011, at least 19 veterans have died because of the delays in simple medical screenings like colonoscopies and endoscopies at various VA hospitals or clinics. Let me say that again. In 2010 and 2011, 19 veterans died because of delays in getting simple medical screenings related to cancer. The veterans were part of 82 vets that have died or are dying or have suffered serious injuries as a result of delayed diagnoses or treatment. Loopholes in the VA performance. An Iraq and Afghanistan combat vet who is also a former mental health administrator at the VA Medical Center in Manchester, New Hampshire, said in April 2012 that the VA hospital managers across the country regularly sought loopholes to get around meeting performance requirements. He explained that meeting a performance target rather than meeting the needs of a veteran becomes the overriding priority in providing care. He went on to say that offering bonuses to managers to make sure that they met performance requirements creates a perverse administrative incentive to find and exploit loopholes that will allow the facility to meet the numbers without actually providing the services or meeting the expectations of that the measures dictate. And finally, this one is not from the IG or Inspector General's report, but in a hearing in the House Veterans Affairs Committee, April 9th, about a month ago, the deputy for the VA Inspector General for Healthcare Inspections stated, quote, "I believe that the VA has lost its focus on the importance of providing quality medical care as its primary mission. There is no good explanation for these events. They are not consistent with good medical practices, they are not consistent with common sense, and they're not consistent with VA policies that exist." Mr. President, it is amazing to me, it's so troubling to me that we have these reports over a long period of time across the country, not isolated incidents. And it's even more troubling to me that despite these reports, these inspections, these criticisms of the VA, it's hard to find any evidence the VA is doing anything to improve its record, its performance, or to better care for the veterans of our country. We should demand more, and we need leadership at the Department of Veterans Affairs that will do so. As I indicated yesterday, I don't believe that this is a matter of money. 60% increase in VA spending since 2009. Normal increases of 2, 3, or 4% each year over the last several years. As I indicated yesterday, the President himself talked about how successful the administration has been in providing the necessary resources for the Department of Veterans Affairs. Our veterans deserve better care and treatment. These are the folks we ought to honor and esteem. These are the people that we must live up to with our commitments to provide the benefits and health care that they deserve and have earned. If these were isolated instances, they would be a terrible thing. But because they are so pervasive, because they are so widespread and because there appears to be no effort to correct the problems, it is important, it is critical that Congress and the American people demand better service, care, and treatment for our nation's heroes. Mr. President, I yield the floor, and I notice the absence of a quorum.
Clerk will call.